focus now with Dr. Badhwar is going to be first get a take on how things have moved on the virus front in this lockdown period, and B, we would also request Mr. Badhwar today to really point out the hardships and the reality what the medical professionals are facing. That's the first line of defense, and how essentially is the first line of defense protected. Dr. Badhwar, thank you for your time. I know these are busy days for you. These are tough days for you. Doctors across India are working round the clock 24/7. So, a salute and our prayers for the safety of all the doctors and the nurses in India and all the medical workers who are working round the clock. So, Dr. Badhwar, in the lockdown period, if one looks at the progress of the virus, and I'm going by official data, can we start celebrating the good news? Because unlike the pattern what the virus has taken in Korea, China or India or US, looks like in India the news so far is good.
Morning to you, and thank you for your remarks. Nikunj, it's early days yet. The lockdown is working. The whole aim is to flatten the curve. So I guess we have achieved that to a certain extent, but the ultimate success would be assessed when the lockdown is over and we assess our results with the results of those countries who have not stringently maintained a lockdown. Yes, your point is correct. The number of cases have gone up, but not to that extent. But what is encouraging is that the mortality rates are still low. So like you said, it's a warlike situation, but there's no room for panic. We have to put our heads down, prepare for what's coming, and tackle it front on.
So, Dr. Badhwar, what will be the first harbinger of good news? What would be the data point which we all should await and pray that if the trend moves in this direction, we can all start breathing a sigh of relief?
So, see, these are early days yet, and we have some, very intelligent people working on this, like the ICMR, and a lot of my colleagues working behind the scenes. So I would say, 2 weeks from now, we would get an indication of how things are working for us. So these are early days yet.
On the medical front, there are lots of WhatsApp forwards which keep on coming that you should do this, you should not do this, you should eat this, you should not eat this. What is right and what is wrong? And when should we expect a medical breakthrough?
People are working on the vaccine, people are working on various drug protocols. So that's, still at a very early stage to make a statement on this forum. But work is at hand. And all our colleagues are working 24/7 to find the exact regime which should be initiated in such cases and what drugs are effective. I would urge all your listeners and viewers not to get taken in by the WhatsApp forwards to take medicines without prescription. All that is a strict no-no. But what is essential is stay at home, stay healthy. That would be my takeaway point.
But is there enough medical protective or medical gear available in hospitals where our doctors, nurses, paramedicals, can they stay safe? I mean, they are not at home, they are doing their duty, they are trying to save the nation. But how protected and how safe is the first line of defense in India?
So this is something which is globally, Nikunj. If you see the news across the world, be it Spain, Italy, New York, America, and India, there is a shortage of masks. There is a shortage of personal protective equipment. There was a study done in Seattle. One COVID positive patient, if he has to be really taken care of around the clock, you would need 10 to 15 suits just for one person. So with a view to that, yes, stocks are there. The government is apprised of it. A lot of manufacturers from other sectors are coming in to ramp up the manufacturing of masks and personal protective equipment. Even the defense, the DRDO, the defense, they have large capacities which are being called in to support the government's effort. So yes, there is a shortage, but most healthcare institutes are prepared. We have stocks for a couple of weeks, and then I'm sure new supplies would come in. But yes, the focus is to protect the healthcare worker who's working on the front line. So we need to have adequate masks, personal protective equipment, and most importantly, all the institutes are running programs to train the healthcare workers how to protect themselves. How do you wear a mask? What is an effective airtight fit? How do you don the personal protective gear? How do you take it off? How do you maintain hygiene? And for your information, most of the teams who are working on the front line are, for example, in our hospital in Kokilaben, they stay within the hospital campus. They don't go home. So if you're working in a COVID ward, you would be staying on the hospital campus, and you would not be interacting with other members of the population.
But Dr. Badhwar, masks and suits is one thing, but what about key infrastructure such as ventilators? We've been hearing news reports that, a lot of automotive companies are now gearing up to build ventilators, M&M being one such case in point, perhaps Maruti as well is pitching in. How geared up are hospitals in Maharashtra and in particular Mumbai for key infrastructure such as ventilators, which as per our understanding are critical to the treatment of COVID?
Yes, ma'am, that's a very important point. That brings us back to the point that our investment in healthcare infrastructure has not been up to the mark. So rough figures, we have about 70,000 ICU beds in India. We have approximately between 40,000 to 50,000 ventilators available in India. So yes, they are enough for what we are facing right now. But should there be a deluge of cases, we would need more. So that's why all the organizations are hard at work. The government is apprised of this, and orders have been placed for more such equipment. As far as Mumbai is concerned, yes, our hospital and other hospitals in the private sector, the new effort at the Seven Hills Hospital, that just goes to show that the health authorities are apprised of this and are taking necessary steps.
Sure. But what's the plan B, Dr. Badhwar? You said that supplies are going to run out after 3 weeks. What about critical medicines as well? While the vaccine is going to be maybe 1 or 2 years away, but what about the treatment medicines? We understand that chloroquine has been passed as one of the treatment drugs. Are supplies readily available for the treatment drugs at least?
Okay, firstly, correction. I did not say that supplies are running out in 3 weeks. There are adequate stocks and more are coming in. Secondly, you see the treatment regime is being formulated by the ICMR, and most hospitals are following those, and the drugs for those are readily available with our hospitals, and we are making sure that no drugs are dispensed without prescription. So as of now, adequate medicines are available.
So, Dr. Badhwar, what to your mind is need of the hour? We understand one is ventilators, second is availability of quarantine facility. But what needs to be done to protect our first line of defense is where I go back to, because the first line of defense is the most important line of defense. Kokilaben, you've shared your experiences, but what is your understanding about some other hospitals, not in metros, but maybe in semi-metros? What about the productive gear and availability of protection gear with them?
So you see, the government is apprised of this, and as you know, 51 healthcare workers in Italy have succumbed to the illness. In today's news, an ENT surgeon in UK, succumbed to this. In India, about 7 to 10 healthcare workers have contracted the COVID-19. So the medical fraternity is aware of this, and that's why most hospitals across the country are seeing essential cases only, and universal precautions are being taken. That is, when you examine someone with symptoms or not, you take it that he may be infected and take all necessary precautions.
Okay, slightly deviating away from the topic now. It was earlier believed that hot temperature and humid temperature may kill the virus automatically. That is what we all thought, we discussed, and we are hoping for. Summers have started kicking in. It's getting hot and humid in Mumbai. Delhi also temperatures have gone up. So do you think one should now start assuming that because of high temperature and because mercury levels are going down, the virus will die its own natural death?
Because these are early days yet, we are dealing with an uncanny virus. We really don't know how things are going to play out. So we have to wait and watch. And there are a lot of things like in India, most people have been vaccinated with BCG. This is an area where it is a hollow endemic zone for malaria. All these things have been postulated to protect our populace. Also, there is also a postulation of innate immunity in our population, but those are all postulations. It's early days yet. We have to see how it plays out. But what is encouraging is, despite the numbers in India, despite the timeline which is there, our mortality is still low. But yes, early days, we have to watch out how it plays out for the next 2 weeks. For that, everyone's participation in this is extremely important. So one should stay at home, stay safe, and prevent transmission of the infection.
Okay, Dr. Badhwar, good to have you on the show. Stay safe, and we'll see you on the other side of the lockdown, hopefully.